Our last grouping of palpations that we need to focus on for the wrist and the hand is going to be the dorsal side of the wrist. A lot of times go ahead and rest your elbow on my knee. There you go. A lot of the carpals are going to be a lot easier to palpate on the dorsal side than on the palmar side. And again, just because of the extra muscles and structures that are on that palmar side, it tends to be a little bit harder. So with our scaphoid, we're going to find that anatomical snuff box. And within that anatomical snuff box, we should be able to find the scaphoid. It's going to be kind of peanut shaped, and you may need to ulnar and radial deviate their wrist to really find it. When you do get it and push in there, it is going to be a little bit tender regardless if they have a pathology, so just be aware of that. So we have that scaphoid. If we move towards the ulnar side a little bit, you're going to then run into the lunate. Remember, another great way to find that lunate is to use Lister's tubercle off of the radius, and you're going to run right into that. The other carpal in the proximal row from this side is going to be the triquetrum is going to be the third carpal bone that you'll be able to feel in that proximal row. Remember that pisiform is a lot easier to palpate on the palmar side. Okay, so that's the fourth one that makes up the proximal row, right? Some lovers try positions. Our scaphoid, lunate, triquetrum, and pisiform make up that proximal row. Our distal row is going to be our trapezium, which is going to be in line with our first metacarpal. Our trapezoid, which is going to sit, again, as we're working our way toward the ulnar side, is going to sit just below that second metacarpal. So again, as a way to kind of get your alignment with that. We have our capitate, which is going to be the next one in line on our dorsal row, and that's going to be lined up with our third metacarpal. Okay, so we should be able to palpate that way. And then our hamate is going to, it's a bigger carpal bone, and it's going to be in line with the fourth and the fifth metacarpals on the dorsal side. So you should be able to palpate those as well. So that they can't handle are trapezium, trapezoid, capitate, and the hamate on that distal row of those of the carpal bones. The last two things we want to palpate from the dorsal side of the hand and the wrist is going to be our extensor carpi radialis brevis and our extensor carpi radialis longus. Again, both originating on the lateral epicondyle at the elbow, and then it's going to come down their muscle bellies kind of in that beginning part of the forearm, and then the tendons running their way down into the wrist and the hand, where you again can have them extend their fingers, you can have them extend their wrist, and you can see where all of those tendons start to pop.